Hello, my name's Amy Bean. I'm the clinical specialist for Saebo. I'm going to take you through how to assess for, measure and fit the SaeboStretch splint. When you're assessing for the SaeboStretch, you need to make sure that your patient meets the minimum criteria. SaeboStretch is not suitable for patients with severe tone or severe soft tissue shortening. For the minimum criteria, you need to ensure that you can passively get their wrist into a neutral position with fingers straight. To do this, you want to take their wrist into flexion, get their fingers straight, all the IP joints and MCP joints, and slowly take the hand through range. If it takes a lot of force to reach this position, then your patient is not suitable. In this case, the candidate is suitable for the SaeboStretch. To determine which size SaeboStretch you need to take a horizontal measurement just distal to the MCPs. This measurement needs to not wrap around either side of the hand and be exactly what it reads on the tape measure. Ideally, you want to get your patient's fingers straight on a table in front of them. If the fingers curl, you can still take the same measurement. So we take a horizontal measurement across and we read exactly the measurement where my thumb is. This measurement will then tell me whether we want a small, medium or large SaeboStretch resting splint. Once you've received your SaeboStretch resting splint, you need to open the box. Inside the box you receive a product manual which will take you through how to fit the SaeboStretch splint. Your SaeboStretch will be bagged. Before you open the bag, you need to ensure that the size that you have requested matches your patient's hand. So you want to lay your patient's hand over the top of the bag and ensure you're happy with that size before you open it. If you're happy with that size, you open the bag. You'll also receive a bag with some additional hand plates. You will have a weaker yellow hand plate and a slightly stronger blue hand plate. Every SaeboStretch is fitted with a red hand plate which is of medium resistance. In addition to the hand plates, you will also receive a screwdriver and some additional screws for you to use. The next step is to determine what wrist angle to set your SaeboStretch so that you're providing a gentle stretch to the long finger flexors. So you want to take your patient's hand, take the wrist into flexion, get the fingers straight, and then slowly take the wrist up through range until you start to see a resistance or the fingers blanching. So in this case you can see the index finger starting to blanch and curl. So the wrist angle is about 10 degrees flexion. For chronic patients, you may find that you need to put the wrist into flexion, but you need to be aware not to put it greater than about 35 degrees, as you don't want to increase pressure on carpal tunnel. But in this case we're happy that the model meets the criteria and we're going to set the wrist angle at 10 degrees flexion. You want to take your SaeboStretch to a hard edge surface and bend the wrist angle. In addition, you want to bend up the wings at the back for the forearm. You want to bend the thumb stop and you want to take the thumb into slight opposition. At this point you may have decided to alter the web space stretch if your patient had reduced range. When fitting the SaeboStretch, you want to start with a distal forearm strap to secure the forearm tightly in place. Once this is done snugly and the whole splint is fitted, you can always come back and take off the tension slightly. Then you want to go to the more proximal forearm strap and secure this in place. You then want to do the thumb strap, and at this point don't worry if the fingers aren't straight on the handpiece, as we can uncurl them as we move down with fitting splints. Next strap is the hand strap to keep the palm in place. So as we're doing this, we can start to uncurl the fingers. Then going to move on to the 2 finger straps, and these are to secure digits 2, 3 and 4 in place, as there is a separate strap for the little finger to keep that in place. So these need to be strapped securely to the Velcro underneath, and then finally we're going to secure the little finger strap. Once you're happy that the splint is fitted, you're then going to get your patient to do something that exerts energy. So that may be taking a couple of steps forwards. If you want to have a go, just a step forwards. So what you're checking for is that the hand doesn't pop out of the splint, and then a couple of steps back. If that did happen, you can change the wrist angle into slightly more flexion, or you could go to a slightly weaker hand plate. But in this case, we're happy that the hand has stayed in the splint. Once you're happy with the fitting, over time you want to gradually increase the wrist angle so that you're increasing the soft tissue length of your patient's hand. If you have any queries with fitting your SaeboStretch, please contact the technical team at Saebo. Thank you.